During the 19th century, the trend of housing people with mental illnesses in almshouses and prisons decreased. Many general hospitals developed psychiatric wards. Giant state psychiatric hospitals were built in the countryside to reduce the effects of industrialization, a possible cause of mental illnesses. Patients worked at state hospitals, gardening, and tending to dairy cattle. Some patients even worked in coal mines. This allowed the institutions to become almost self-contained, as if they were small cities. In the beginning of the 19th century, a German physician, Johann Ryle, coined the term psychiatry. Dr. Ryle wrote about the suffering of the insane in asylums and developed treatment methods. Moral treatment was an approach to mental illness based on humane psychological and social care, with pleasant and routine environments coupled with moral discipline. Early in the 1800s, caring for people with mental illness was primarily custodial, meaning the focus was on housing, keeping them off the streets, and tending to their physical needs.
I come to represent to you the condition of a numerous and unhappy class of sufferers who fill the cells and dungeons of the poorhouses and the prisons of your state. These most unfortunate beings have claims, these claims which bitter misery and adversary creates, and which it is your solemn obligations as citizens and legislators to cancel.
Throughout the 19th century, many superintendents pushed for less use of mechanical restraints. Although European hospitals had done away with them, some American superintendents rationalized that Americans were so freedom-loving that they rebelled more than Europeans when they were hospitalized, making restraints necessary. Over the 19th century, psychiatry evolved from a custodial to a biological approach. Treatment consisted of isolation, confinement to bed, overfeeding, electrical stimulation, and massage. Freud developed treatments in which patients spoke about their problems, named the talking cure by Anna O. Freud's goal was to locate and release powerful emotional energies that had initially been rejected or imprisoned in his patients' unconscious minds. Freud called this psychic action repression, and he believed that it was an impediment to the healthy functioning of the psyche, causing symptoms to surface which he termed psychosomatic. Interventions progressed from none to moral treatment, while psychiatric theories ranged from phrenology to the psychology of emotions to dream interpretation and psychoanalysis. Psychiatry appeared in the curricula of a handful of medical schools. Within a few years, it would stand beside other specialties and enjoy a permanent place in medical education.